As we age, our teeth become more vulnerable, and what once seemed like a minor issue can turn into serious problems. Many people face dental and oral health issues without realizing what they're doing wrong. Let's break it down. Today, we'll discuss 5 common mistakes we often make and 5 steps to keep our teeth healthy for years to come. We often brush our teeth automatically, not thinking about the technique. It seems like a simple task. Grab the brush, apply toothpaste, and go. But this is where one of the most common mistakes lies. Brushing your teeth isn't a race against time, but rather a process that requires attention and thoroughness. Have you ever thought about how even a few seconds missed on technique can lead to enamel destruction and plaque buildup? Ask yourself, how much time do you actually spend brushing your teeth? 1 seconds? A minute? That's much less than recommended. Stop, think, and pay attention to how long you brush your teeth. You might not even notice how quickly you switch from one tooth to another, and these aren't just extra seconds. They are real harm to your health. Let's talk about the brush. How much do you know about choosing one? Some people think the stiffer the bristles, the better, but that's far from the truth. In fact, hard brushes can damage not only the enamel, but also the gums. Our teeth should not be subjected to excessive pressure. This is more of a risk than prevention. What about electric toothbrushes? Many of us hear about these as a miracle for dental health, but it's important to remember, improper use of an electric toothbrush can be just as harmful as using a regular one. Did you know that they can damage gums if used for too long in one spot? A simple tip: choose brushes with soft bristles and focus on technique, not strength. Proper brushing technique is the secret to strong teeth. And this is not just words. Many people don't even think that teeth should be brushed in circular motions, not just lingering in one spot. It's important to gently move the brush across each tooth, paying attention even to those in the hardest to reach places. Each tooth should get individual attention, not just be cleaned with a few quick moves. Simple rules: brush for at least 2 minutes, thoroughly and gently, and don't forget about the back teeth and tongue. At first, it might seem like this takes too long, but over time you will feel the difference. Think about it. Are you ready to invest those couple of minutes into your dental health? When was the last time you thought about which toothpaste to use? It's just as important as the brush itself. Many people choose toothpaste based on price and flavor, but that's not the best approach. Some toothpastes can be too abrasive, which can damage the enamel, especially if you have sensitive teeth. Or perhaps you prefer whitening toothpastes, forgetting that they can damage enamel with frequent use. Choose toothpastes with low abrasiveness, which not only clean the teeth but also protect them from damage. Have you ever noticed that your teeth are sensitive after brushing, or perhaps your gums often bleed? This could be a sign that you're brushing incorrectly. Think about it. These aren't just temporary inconveniences. They are signals indicating that your technique needs improvement. If your teeth hurt or your gums inflame after brushing, you might be pressing too hard on the brush, or maybe you're not spending enough time on hard-to-reach areas. Brushing teeth is more than just removing plaque. It's about maintaining health. And if you have to endure painful sensations, it's a signal for change. Brushing teeth is an art that requires not only the right tools, but also the right technique. Every detail matters, and it's these details that determine whether your teeth stay healthy or become vulnerable to diseases. We all know that visiting the dentist isn't the most pleasant activity, and it's exactly at this moment that many of us prefer to put it off. After all, if your tooth doesn't hurt, why go to the doctor? But this is a huge mistake. Think about it. How often do you visit the dentist? Once a year, once every 2 years, or perhaps you avoid it altogether? You might be confident that your teeth are fine, but hidden problems can develop over years without showing any symptoms, and when a problem does arise, solving it can be much harder and more expensive. Ignoring visits is like stopping maintenance on a car, thinking it will never break. Sooner or later, the consequences will show. Imagine if you missed just 2 dentist visits. Over those 2 years, hidden gum diseases or cavities could develop, slowly but surely ruining your teeth. Many dental problems, such as cavities or infections, can be detected at early stages when they haven't caused significant damage. Regular dental visits are an opportunity to detect problems before they become serious. But what's even more important, it's a chance to learn how to properly care for your teeth, which toothpastes and brushes work best for you, and what other factors could affect your health. Did you know that regular checkups help not only avoid cavities, but also prevent gum diseases? Gum problems are one of the most common causes of tooth loss in older people. So don't wait for pain or discomfort to book an appointment. In dentistry, like in other areas of medicine, the earlier treatment begins, the more successful it will be. Many people find it difficult to overcome their fear of the dentist. This is a completely normal feeling related to unpleasant memories of dental procedures in the past. But if you're afraid of the dentist, it doesn't mean you should put off the visit. In fact, modern technology and treatment methods have significantly reduced the discomfort during procedures. Today, dental clinics are equipped with new pain relief methods, and dentists can offer pain-free procedures, from local anesthetics to hypnosis, if you can't tolerate even the slightest pain. Don't let fear control you. Your teeth deserve attention, and regular visits to the dentist are the key to maintaining their health. As we age, dental health becomes especially important. The aging process affects bone density, which can lead to tooth loss or more serious gum diseases. The older we get, the more vulnerable our teeth become. They are more prone to cavities, and gums are more likely to become inflamed and atrophied. Older people often face issues like dry mouth due to medication, which also increases the risk of oral diseases. Therefore, regular visits to the dentist in old age are not just a recommendation, but a necessity. Modern dentists offer personalized dental care programs for older adults, helping to manage these age-related problems. This is not just a treatment plan, but a whole set of recommendations for oral care that will help keep your teeth as long as possible. A visit to the dentist isn't just a check for cavities. It's a comprehensive set of procedures that can prevent various diseases. Preventive cleaning. The dentist carefully removes tartar and plaque, helping to prevent gum diseases. Gum examination. The doctor checks the gums for signs of inflammation or other issues. X-rays. They help identify hidden problems, such as cavities between teeth or root diseases, which are not visible to the naked eye. Assessment of fillings and crowns. It's important that artificial dental elements don't become sources of problems. Thus, a visit to the dentist is not only a chance to detect, but also to prevent more serious diseases that may develop in the future. Don't view the dentist as an enemy to be feared or avoided. On the contrary, they are your main ally in the battle for healthy teeth. A dentist is not just someone who treats teeth. They are an expert who helps you maintain your oral health at the highest level. Your relationship with your dentist should be built on trust. A good dentist is not the one who removes your teeth at the first opportunity, but the one who offers you the right solutions to maintain your dental health for many years to come. When it comes to choosing a dentist, many people face difficulty. After all, this is the specialist to whom you entrust your health. But how can you tell if a dentist is truly worthy of your trust? Reviews and recommendations. It's important to hear the opinions of other patients. Reviews can reveal a lot about a dentist's professionalism, clinic quality. It's crucial that the clinic is equipped with modern equipment and follows safety standards. Experience and qualifications. Make sure that your dentist has the necessary education and experience to address the issues appropriate for your age. Remember, healthy teeth are the key to self-confidence and a high quality of life. So, make the dentist your partner in caring for your health. Ignoring regular dental visits is a huge risk for your teeth, especially as you age. Remember, your health is in your hands, and the sooner you start taking care of your teeth, the easier it will be to avoid problems in the future. Don't wait until a tooth starts hurting or your gums begin to bleed. Timely prevention and regular checkups will help you maintain a healthy smile for many years. We all brush our teeth, but do we use dental floss? This small but powerful tool often goes unnoticed in our daily hygiene routine. It seems that if we brush our teeth twice a day, what else is needed? However, this is a deep misconception. When you brush your teeth, the brush can't reach all corners of the mouth. Yes, it cleans the surfaces of the teeth, but what happens to the spaces between them? It is here, in these tiny gaps, that bacteria begin to develop, which cause cavities and gum diseases. Using dental floss is a preventive measure that many neglect, not realizing that these unreached areas become a potential threat to their health. What makes dental floss so important? It's not just a fashionable accessory for brushing your teeth. Dental floss helps remove plaque and food particles from hard-to-reach places where the brush cannot reach. But it's not just a hygiene measure. It's protection from diseases. Bacteria left between the teeth can cause gum inflammation, which in turn leads to periodontitis, a disease that, if left untreated, can result in tooth loss. Think about it. You wouldn't skip brushing your teeth with a toothbrush, right? So why ignore dental floss? Without it, all the brushing effort may be in vain. It's like trying to clean a house but forgetting the corners. Dental floss isn't as simple to use as it may seem at first glance. Many people do it incorrectly, thinking it's enough to just run the floss between their teeth. But proper technique plays a huge role. Don't yank the floss. Many people make the mistake of pulling the floss too tightly, applying pressure to the teeth and gums. This can lead to gum tissue damage. Wrap the floss. It's best to take about 45 centimeters of floss and wrap it around your index fingers, leaving a small, working part. Use slow and gentle motions. Use a forward-backward motion, but don't rush, to avoid injuring the gums. Remember, dental floss should be part of your daily hygiene routine. Spending 2 to 3 minutes using it every day is a small sacrifice for long-term dental health. There are many myths surrounding dental floss that can mislead us. For example, many believe that dental floss is dangerous because it can damage the gums. But in fact, this isn't true if it's used correctly. Let's debunk these myths. Myth 1. Dental floss can damage your teeth. This isn't true. Dental floss cleans the space between teeth without damaging them. On the contrary, it prevents diseases that could arise from bacterial buildup. Myth 2. Floss can tear the tooth. This can happen if you use floss that is too thick or rigid, but modern flosses are specifically designed for safe use and don't break even in the tightest spaces. Myth 3. Dental floss isn't that effective. In fact, studies show that using dental floss is 40% more effective at preventing gum disease than brushing with a toothbrush alone. As we age, our dental health becomes more vulnerable. Gums begin to recede, and larger gaps form between teeth, where food particles and plaque accumulate. At this time, using dental floss becomes not just a recommendation, but a necessity. As we grow older, our gums and teeth need extra care. For elderly people, dental floss becomes especially important, as the risk of gum disease and tooth loss increases due to age-related changes. But here's some good news. Using dental floss correctly can help preserve your teeth for many years, despite age-related changes. If dental floss is the foundation, it can work in tandem with other oral care products. For example, mouthwashes can help further eliminate bacteria and strengthen gums. However, it's important to remember that they don't replace dental floss. They only support overall hygiene, but cannot properly clean between teeth, as floss does. Additionally, consider using a water flosser, a device that uses a stream of water to wash away food particles and plaque. It's a great supplementary tool, but it won't replace daily flossing. You've probably already realized that dental floss isn't something to be used once a week. For it to be effective, you need to use it daily. Some specialists recommend using dental floss twice a day, before or after brushing your teeth. This will help you remove all food particles and plaque, preventing bacterial buildup between your teeth. Spending just 2 to 3 minutes a day will significantly improve the condition of your teeth and gums. Yes, it takes time, but trust me, it's worth it. Now let's think. What if you ignore the use of dental floss? A few years from now, you might face issues that will be difficult to fix without significant treatment costs. Prevention is much cheaper and easier than treatment. Dental floss isn't just a hygiene tool, it's an investment in your future. You have just a few minutes a day to save hundreds or even thousands of rubles on dental services in the future. Skipping dental floss isn't just a small mistake. It's a path to serious dental and gum problems that could have been prevented. By incorporating dental floss into your daily routine, you are making a huge step towards preserving your oral health and avoiding many future problems. Remember, today's efforts will give you a strong and healthy smile for many years to come. We all love sweets, coffee, citrus fruits, and dairy products. But what's delicious isn't always good for our teeth. Our teeth are not just tools for chewing food. They serve as a defense for our body against external factors, and it's the excessive consumption of acidic and sugary foods that can play a cruel joke on us. When we eat or drink acidic or sugary foods, these substances come into contact with enamel, the hardest substance in our body. However, despite its strength, enamel begins to break down under the influence of acids. This makes teeth more vulnerable to cavities and other issues. Even if you brush your teeth after eating, the acids from food continue to affect the enamel. But is there a way to prevent tooth decay if you can't give up your favorite foods? We will explore the answer to this question in the following sections. It seems that sweets can't be that dangerous if they just melt in your mouth without leaving any solid residue. But in reality, sugar is a direct path to tooth decay. Once sugar enters the mouth, it starts interacting with the bacteria that naturally exist in our oral cavity. These bacteria feed on sugar and begin to release acids, which break down tooth enamel. But that's not all. With every intake of sweets, we create an environment for bacteria, which makes our teeth vulnerable for an extended period. How does this work? After we eat sweets, the acidity in the mouth increases, and the tooth enamel begins to dissolve, making teeth more susceptible to cavities. Sweets, especially those that get stuck between teeth, become an ideal food source for bacteria. Think about it. Do you want to risk the health of your teeth every time for a few minutes of pleasure from a piece of chocolate? The choice is yours, of course. In addition to sweets, another major enemy of teeth are acidic foods. Citrus fruits like oranges, lemons, grapefruits, as well as acidic drinks like juices with added citric acid, can have a destructive effect on tooth enamel. Acidic foods, when they enter the mouth, begin to dissolve the enamel, which makes teeth more vulnerable to damage and cavities. One of the main problems is that many people consume acidic foods without realizing their harmful effects. Citrus-based juices, lemon cocktails, even sour candies can have the same destructive impact. What happens at that moment? The acids temporarily dissolve the protective layer of enamel, and if the teeth don't have enough time to recover, the destruction process becomes irreversible. After consuming acidic foods, it's important to remember that the teeth become vulnerable. Acids disrupt the enamel structure, making teeth soft and prone to damage. The key is that for 20–30 minutes after eating, teeth remain weakened, which increases the likelihood of damage. But what can you do in such situations to minimize the harm? First of all, don't brush your teeth immediately after consuming acidic foods. This could lead to further enamel damage, as it will be soft and susceptible to mechanical impact from the brush. It's best to wait about half an hour for the enamel to regain its strength. Additionally, it's important to remember that constant exposure to acidic foods isn't a one-time mistake. It's long-term damage. If you frequently eat acidic fruits or drink acidic beverages, your teeth become more vulnerable. So, the cumulative effects of acid over time become more noticeable. So, if completely giving up sweets and acidic foods isn't possible, what can be done to protect your teeth? Fortunately, there are several simple ways to reduce the risk of enamel destruction. Drink water after eating sugary or acidic foods. This helps neutralize acids in the mouth and quickly restore the normal pH level. Use a straw. When drinking acidic beverages, use a straw to minimize contact between the liquid and your teeth. Brush your teeth properly. Make sure to brush your teeth twice a day using fluoride toothpaste. This will help strengthen enamel and improve its protection. Use mouthwash. Mouthwashes help remove food residue and neutralize acidity, preventing tooth damage. Eat foods that strengthen your teeth. Vegetables, cheeses, and nuts all help neutralize acids and promote strong teeth. Caring for your teeth doesn't require sacrifices, just the right approach. What if your enamel is already damaged? Restoring enamel is not an easy task, but there are several methods that can help return the strength of your teeth. Use fluoride toothpaste. Fluoride helps strengthen enamel and makes teeth more resistant to acids. Professional teeth cleaning. Regular professional cleaning will help remove plaque and prevent bacterial buildup that could cause further damage. Calcium supplements and foods. Dairy products, nuts, and calcium supplements can help strengthen tooth enamel and restore its strength. However, as much as we might wish, fully restoring damaged enamel is impossible. The best thing you can do is prevent damage from the start by maintaining a proper diet and hygiene. As we age, our teeth become more vulnerable, and this is especially noticeable with poor nutrition. Foods high in sugar and acid become particularly dangerous for older adults because their teeth and gums are already weakened by age-related changes. At this age, the risk of cavities, inflammation, and other dental diseases increases. But old age is not a sentence. If you take care of your teeth and eat properly from a young age, you can keep them healthy for many years. It is especially important to be cautious with acidic and sugary foods to minimize harm and maintain strong teeth. Excessive consumption of acidic and sugary foods can be harmful to dental health, but that doesn't mean you need to completely give up your favorite treats. The key is moderation and taking care of your teeth with proper hygiene and nutrition. If you want to keep your teeth healthy and strong, it's important to follow simple recommendations and remember that every step in care matters. Water is not just a source of life, it plays a key role in maintaining the health of our oral cavity. We all know that water is essential for life, but few consider how much it affects the condition of our teeth. Water supports the level of saliva, which is the body's natural protector for teeth. Saliva not only moisturizes the mouth, but also helps neutralize acids that can destroy tooth enamel. When we don't drink enough water, saliva levels drop, and this can lead to a condition known as dry mouth. This condition increases the likelihood of cavities and gum diseases since saliva isn't performing its protective function. Furthermore, saliva helps remove food residue, preventing bacteria buildup. Without sufficient hydration, the process of protecting the teeth from harmful substances is significantly weakened. When we eat acidic foods or drinks, such as citrus fruits, juices, or carbonated drinks, the acidity level in the mouth increases, which can lead to the destruction of tooth enamel. Water plays an important role in neutralizing these acids. The more water you drink, the faster the normal pH level in the mouth is restored. Drinking water immediately after eating or drinking acidic beverages is not only refreshing but also beneficial. Water helps rinse away food residue, preventing it from interacting with bacteria and acids. Prolonged exposure to food in the mouth, especially sweet or acidic foods, increases the risk of cavities. Water, in turn, helps minimize this risk. In addition, Water helps better absorb beneficial nutrients like calcium, which is essential for the health of teeth and bones. Maintaining a normal water balance helps teeth receive the necessary nutrition and strengthens them. Gums play as important a role as teeth in maintaining oral health. Dry mouth isn't just a risk for teeth, but also for gums. When saliva levels drop, the mucous membranes in the mouth become more vulnerable to inflammation. This leads to conditions such as gingivitis or periodontitis, which can cause pain and tooth loss. Often, we don't realize how important hydration is for our gums. Gums need constant protection and hydration to stay healthy. Water not only helps moisturize the gums, but also improves blood circulation in the mouth area, promoting their recovery and preventing inflammation. One unpleasant effect of dry mouth is the development of bad breath, or halitosis. This happens when bacteria left in the mouth begin to break down food remnants and release unpleasant compounds. A lack of water intensifies this process because saliva, which typically cleanses the mouth, can't cope with the bacteria. Regular drinking helps maintain saliva levels, which cleanses the mouth, neutralizes bacteria, and eliminates bad breath. Additionally, water helps maintain fresh breath by ensuring the cleanliness of the oral cavity without excessive bacteria buildup. Drinking water also helps prevent plaque buildup on teeth, which is not only a source of bad breath but also contributes to cavity formation. Therefore, regular water consumption is not only beneficial for your teeth, but also for your overall well-being. When we eat sweet or acidic foods, tooth enamel is subjected to damage. This can lead to its weakening, making teeth more vulnerable to harm. But it's important to understand that drinking water right after eating helps refresh the oral cavity and restore the normal pH balance, reducing the damaging impact of acids. Water, especially if it's fluoride-enriched, helps restore tooth enamel. Fluoride strengthens teeth, making them more resistant to acids and bacteria. Fluoridated beverages can help reduce the risk of cavities and improve tooth protection. Moreover, mineral water can be beneficial as it helps replenish missing minerals in the body, improving the health of teeth and bones. Not all water is equally beneficial for teeth. For example, drinking water containing fluoride can provide additional protection for teeth by strengthening them and preventing cavities. Therefore, it's important to choose water that not only hydrates, but also contains beneficial minerals. Some tips for maintaining dental health through water. Drink water with fluoride. This mineral helps strengthen teeth and prevent enamel decay. Drink water throughout the day to maintain normal saliva levels. This is important for protection against bacteria and acids. Avoid drinking carbonated drinks and sweet juices that contribute to enamel decay. If you do drink such beverages, it's better to use a straw to minimize contact with teeth. Drink water after meals. This helps wash away food residue and neutralize acidity, especially if you've eaten something sweet or acidic. It's recommended to drink 8 glasses of water a day to maintain proper hydration of the body and mouth. However, if you are physically active, live in a hot climate, or consume a lot of salty and sweet foods, you may need more water. Incorporate water into your daily life and ensure that your body doesn't experience dehydration. This will not only help maintain the health of your teeth, but also improve your overall well-being. Water is not just a liquid to quench thirst. It is essential for maintaining the health of teeth and gums. Regular drinking helps not only keep teeth strong, but also enhances their protection against external factors like acids and bacteria. Caring for your water balance is a simple yet effective habit that contributes to the long-term health of your mouth. Now you know how to avoid the most common mistakes and what to do to keep your teeth healthy and strong for many years. Remember, dental health is the key to a confident and happy old age. The earlier you start caring for them, the easier it will be to keep them healthy. Which dental care mistakes surprised you the most? Share in the comments and don't forget to like the video if you found it useful.